Good morning, everyone. My name is Edgar Largaespada, and I'll be presenting on prisons, vectors of HIV in Brazil. First of all, I would like to thank my classmates. This paper is a product of the last semester's class taught by Professor Delgado. And it was a wonderful experience, so I want to thank Morgan, Maria Luisa, Rachel, Caleb for a wonderful experience. I learned a lot from them, and especially to Professor Delgado, who really was a mentor in guiding me to write this paper and continues to do so as I move forward with this topic. So thank you very much. So this presentation has three main purposes. The first one is to draw attention to the HIV epidemic in Brazil, to the high incarceration rates in the country. Second, I want to demonstrate how prisons have become vectors of HIV in Brazil. And finally, I want to explore what can be done about this problem. So let's begin. The HIV/AIDS prevalence in Brazil. We see that about 2 million people in Latin America live with HIV/AIDS, and about 1/3 of those are in Brazil. The majority are young people between the ages of 15 and 49, and it especially affects those that are under 30, which means that it cripples the most productive segment of the labor force. So definitely there's a big problem with HIV and has a huge impact on the economic development of the country and the region. So what about the incarceration rates? They have tripled over the last 15 years in the country. And actually, Brazil ranks number 4 among in the world after Russia, China, and the United States. In fact, it has risen from, in 1990, there were 90,000 inmates in Brazil. As of 2009, there are 515,000 inmates. So it's a huge jump in the inmate population in Brazil. So what happens now? In prisons is that they become places where people that are high risk for HIV infection are being concentrated. This is mainly due because of the overrepresentation of intravenous drug users, who actually report about a 60% of reincarceration rates. So incarceration is very common among this population of intravenous drug users, and they are prone to sharing needles because it's a scarcity-driven behavior. They don't have access to clean needles or syringes, so the only option is to share among themselves the few needles that they have, being able to sneak into prison. Now, speaking of what is the environment in the Brazilian prisons? Well, as you can see, recently, last year, The Economist described their headline for the article describing the prisons in Brazil as a journey into hell. And for me, what impacted me was the Minister of Justice in Brazil said this in a public forum, in a newspaper. If I had to spend many years locked up in one of our prisons, I would rather die. We have a medieval prison system that not only disrespects human rights, but also makes rehabilitation impossible. So if we're taking into account the high rates of HIV/AIDS in the country, the high incarceration rates, we are putting together a recipe for disaster. So the conditions in the prison, obviously we talk about the high incarceration rates, which leads to the overcrowding. The overcrowding depletes the resources that are available to provide appropriate health care, good sanitation services, proper accommodations, to rehabilitation programs for prisoners. In fact, the unsanitary conditions speak of prisons that are designed for 12 people accommodating 48, or prisons that are designed for 24 people accommodating 72 people in one. So in many cases, they are so overcrowded that the bathrooms, the showers are rendered useless, and inmates have to take turns sleeping because there's not enough just not room for people to sleep at the same time. So we talk about poor healthcare, the violence. Because of the overcrowding, guards, first of all, the budget to train, properly train guards is just not there. So guards have to pretty much resort to leaving the prisoners to tend for themselves because they're so overcrowded. Gangs develop with saying that they're going to be fighting for the prisoners' rights, so they pick sides, and these gangs pretty much run the prisons in Brazil. So there's a lot of violence, and many times when a new person comes into a facility, they're forced to pick a side. You either one gang or the other, and many times the way that you pick a side is to prove your loyalty and pretty much killing somebody for another member of the other gang. So how does all this involve? Like, we're talking about a recipe for disaster, right? High incarceration rates in Brazil, high HIV prevalence. How does this come together and create a vector model? Well, prisons are starting to be considered social determinants of health. That means that because they create structural factors that lead to poor health status and outcomes, regardless of the individual attributes. So, in other words, it doesn't matter what you do on a personal level when you're put in an environment that has all these conditions. It's beyond your control to prevent many times that deterioration of your health. In this case, in prisons, tattooing it's a common practice. So even if you're not using drugs, you tend to get tattooed, and they do it with the same needles that prisoners use to inject drugs. And many times, prisoners that come into the facilities that are not drug users end up using drugs because the environment is so bad that it's the only way they can escape a violent, unsanitary, overcrowded environment. So we see that because all these conditions that I've talked about, prisons have become a high-risk environment. An overrepresentation of intravenous drug users, overcrowded, and that speaks to the concentration. It's concentration of the population prone to HIV infections. Amplification, because you have them in one setting and coming in, and easily the risk of contamination is so high that the normal risk of HIV contamination is amplified by these conditions. And the dissemination, about 90% of the population, the inmates, are going to return to their communities in the next 2 years to 30 years. That means that over that period of time, if your chances are so high of being infected with HIV that once you return to the community, you don't even, many times are not even aware that you've been infected with HIV/AIDS, and you go back to having unprotected sex or exposing your family, friends, and the rest of the community to HIV transmission because you have not been educated, you have not been screened for HIV. That is a visual representation of what the vector model looks like. So what I do want to concentrate on is what can we do? What can we do about this? So there are many possibilities. We can reform the criminal justice system. We can do public health initiatives, and we can also implement programs to reduce the sentences of many of the inmates. So what has been done in right now in Brazil in terms of criminal justice? Well, there have been reforms last year that have been submitted for review by organizations like Conectas, which is an organization that works in Brazil, a nonprofit that advocates for this type of reform. And they looked at the new code that is set for review and approval in Brazil, and they make 5 different suggestions, which if you read through them, I personally was surprised that this will be the suggestions from this organization, meaning that they're not even included in the original document. The abolition of prison sentences for nonviolent or seriously threatening offenses. that's a good recommendation because it will keep a lot of the people that do not need to necessarily go through imprisonment out of this facility, and can reduce potentially the overcrowding. The application of alternative penalties, again, another way of keeping people from unnecessarily going to prison. Reduction of delays for transfers to lower security facilities. That is a big problem. The overcrowding also backs up the judicial system. So many times you're just waiting for a hearing and waiting to be transferred to a lower security facility that tends to be less overcrowded. However, that many times doesn't happen for a long, long time. The decriminalization of drug possession for personal use. We talked about drug use has been so criminalized that we forget about rehabilitating drug users, and we have been focusing on just sending them to prison. The reduction of the minimum sentence for drug trafficking up to 3 years. Again, many times drug possession, it is a criminal offense. However, it shouldn't be about being in prison for many, many, many years and not having access to a good program to be rehabilitated. So what can we do? What other programs can we implement? Well, there's a good program that Redemption Through Reading. Inmates are allowed to reduce about 44 days from their sentence by reading books. They present to a board a summary of the book, and the board thinks that the prisoner really put the effort and out of this reading, then they're awarded so many days, and they can get a total of 44 days per year taken down from their sentence. Also, it's a pedaling program. They, as you can see in the picture at the very corner, there's a battery, and his pedaling and charging this battery that it provides public lighting for the plaza in this small town in Brazil. Another thing we want to do, this is the public health initiative I was talking about. Anonymous HIV screening in prisons. This is important because if you've been contaminated, then you need access to retrovirals, or need to be taught about how to change your lifestyle to take better care of yourself and not expose others to contamination, HIV. And so knowing it will give you that power. And also, if you're not infected with HIV, then you can take the necessary steps to protect yourself from future infection. Providing condoms to inmates. Needle syringe exchange programs. Sharing needles among inmates, among intravenous drug users, offering for tattoos, is a scarcity-driven behavior. You don't have access to clean supplies, therefore, the few supplies that are available to you, they're shared among the population. We talked about reducing overcrowding in prisons with reforms. And quickly, I just want to talk about Prison Fellowship International. They promote what is called restorative justice, which we have what is called a punitive justice system. You break the law, commit a crime, you go to prison. This is your punishment. It's a punitive justice system. Restorative justice system has the punishment for violent and severe offenses. However, for lesser non-violent offenses, it provides an alternative. Many times through mediation, many times through rehabilitation programs. And quick examples of that have been here in Pennsylvania being implemented. And the cost per case has been about a little over $48,000 per year. That is a significant decrease from $65,000, almost $66,000 per case for a regular custody program. So that's a significant savings for the state. In Colorado, the recidivism has dropped from to 10% compared to 60% of the national average. That means that inmates that go through this system, their chances of reincarceration are lower to 10%. And the national average is 60%. So not only are we saving money, but we're also giving them an opportunity to stay out of prison. In applying this concept to a Latin American setting, in Costa Rica, we find the example that the average prison cost is $50 a day per person. the average cost of an alternative program is 50 cents. So again, tremendous savings. I think that should be a good incentive for policymakers to take this into consideration now that in Brazil there's plans for new legislation, and hopefully more countries and more policymakers will take notice of this. Thank you very much.